So good afternoon, everyone, and thank you for joining us on our CANVax webinar series. Between the fall of 2019 and winter 2020, we are hosting a series of webinars to explore current and emerging topics in immunization to support and inform the work of public health professionals like you to improve vaccine acceptance and uptake. To learn more about our upcoming webinars and register, please visit canvax.ca/canvax-webinar-series. And this is the link that you can see on your screen. But before we begin, we want to acknowledge that CPHA's office is located on the original unceded territory of the Algonquin Anishinaabe people. They have been the guardians of this land for millennia, and CPHA is grateful for the example their stewardship provides. Today's webinar, Intensive Mothering and Vaccine Hesitancy in the Web 2.0 Era, is brought to you by the Canadian Public Health Association. Through the Project CANVax and its partners, which includes Immunize Canada, the IWK Health Centre, and the Institut National de Santé Publique de Quebec. I'm Hesitancy, Project Officer on the CANVax project with CPHA, and I'll be your moderator for today. If this is your first time on Zoom, please note that the webinar is being recorded and you will be using the Q&A feature at the bottom of your screen to ask questions to the presenter. Only you can see your questions and you may submit them anonymously. Once the question has been answered, everyone will see the question and hear the answer live. Also, if you encounter any technical difficulties during the presentation, please also use the Q&A features to let us know. We strongly encourage attendee participation, and we look forward to hearing your thoughts and questions. So please feel free to submit your questions at any point during the presentation. All questions for the speaker will be answered at the end. And also a couple of quick notes. So the recording of this webinar will be made available on canvax.ca on CPHA's YouTube. You'll also get a copy of the link in a follow-up email as well shortly after the conclusion of this presentation. Please also note that upon the end of this presentation, you'll be invited to complete a short 5-minute survey. The feedback that you provide will be used to assess your satisfaction and identify areas for improvement of the delivery of these webinar series. So please do take the time to provide us your feedback. And if you haven't already registered with CANVax or subscribe to our newsletter, the CANVax Boost, you can go ahead and visit canvax.ca to do so, and you will get access to the latest resources and tools. If you'd like to suggest topics or speakers for upcoming webinars, you can let us know by contacting us through our website or let us know in the post-webinar survey. And so with that, I'd like to introduce our speaker for today's webinar. Our speaker is Maryline Vivion, a medical anthropologist at the Quebec National Institute of Public Health, the INSPQ, in Quebec since 2010. The aim of her PhD was to better understand the different factors influencing parents' vaccination decisions, with a special focus on the role of internet and social media. She did her master research in anthropology as part of a wider research looking at how mothers decide to have their children vaccinated or not. As a specialist in qualitative research methods, she has collaborated on several research projects looking on vaccine acceptance and vaccine promotion. And so with that, I would like to turn it over to our speaker, Maryline.
Okay, so thank you very much. So I will share my screen. Just one moment. Okay, share screen, this will. So I think now you all see my my PowerPoint. So I just want to say hello to everyone. Thank you for joining the webinar. And I also want to thank you, CANVax, for the opportunity to present the result of my doctoral research. And today the presentation, the title is Intensive Mothering and Vaccine Hesitancy in the Web 2.0 Era. So to begin, so I have no affiliation or financial or otherwise with a pharmaceutical, medical device or communication organization. Today for the presentation, it will be very standard. So I will first present the context of my research. I will briefly present my theoretical framework, the methodology that was used, the result, and finally the conclusions. So the context of my research. So maternity is now influenced by many normative representation, sorry, which are culturally specific. For many well-educated, wealthy parents in North America, children's needs have become central, and modern investment and dedication are seen as crucial for children's development. Mothers now have to take care of their child's psychological, affective, and cognitive needs. They have to protect their physical health, but also to ensure the healthy social, emotional, and intellectual development. Those norms and ideals put pressure on new mothers that need to take a lot of decisions for the health of their children. This is known as intensive mothering. So in this normative context where knowledge is valued and crucial for informed decision-making, the internet appears to be an unavoidable source of information for mothers. So in scientific literature, it is often heard that the omnipresence of anti-vaccination content on the internet has contributed to the increase of vaccine hesitancy among parents. So the aim of my doctoral project was to explore the link between internet and vaccine hesitancy. So vaccine hesitancy, so to be a vaccine hesitant parent, they are parents who may refuse some vaccine, but agree to other. They may delay vaccine or accept vaccine according to the recommended schedule, but are unsure in doing so. And we estimate that 30% of parents are vaccine hesitant. So the objective. So the presentation objective is to situate vaccine hesitancy in the larger context of maternity, more specifically intensive mothering. So the theoretical framework that I use. I use the concept of habitus that was developed by Pierre Bourdieu. Based on this concept, I developed the concept of informational habitudes that was operated by three notions. The practice to get informed, which means to check how mothers are getting informed and how they do to search on the internet, the way that they assess information credibility on the internet, and also the reflexivity that they have toward the information that they receive on the internet. For the methodology. So for the methodology, I made an online ethnography from the 1st January to December 31st, 2015, based on non-participant and participant observation on social media group, where discussion on vaccination occurred. So the ethnography was conducted with two groups of mothers having the same months of delivery. One group was on a forum and the other group was on Facebook. And I also get the post on vaccination on group of mothers who valued a natural approach. In order to complete my observation, I also made 19 interviews with mothers. So the group selection, so how did I select the groups? So first, I decided to join mother groups instead of vaccination group because anti-vaccination group and website have already been studied. Also, I wanted to situate vaccination within the maternity question in general. To find this group, I used the result from the search the search tool on Facebook. I also use the group suggestion that Facebook was making, but I mainly use parenting website forum section. On those forums, they use the forum to create groups, and then they go and they migrate into Facebook. And finally, participant suggestion. During the field, some participants direct me to a group where vaccination discussion occur. And this is the way, this is how I joined the group on the natural approach group. It's because some mother told me that this group had some information, they were sharing information on vaccination. So I decided to go and to join the group. For the data collection and the analysis, so I took all the discussion threads from social media and they were downloaded, and the interview were recorded and fully transcribed. I also made a content analysis using the software Vivion. That was a thematic analysis. So the result. So the question is why mothers need to join a virtual community, why they need to go on social media group, and why they are doing that. And the finding of my research shows that mothers join groups that reflect their initial belief and value about motherhood. They join group to break their isolation, to be reassured, and also to get social support. What appears also, it's the mothering group on social media show that vaccination is part of many decisions that mothers need to take for their child. Vaccination was just a little subject on those groups. They appreciate to get and share information on mothering on different subjects, just like sleeping. That was the subject the most important on those groups. Breastfeeding and feeding, that was the second one. A question about child development, family organization, and vaccination. And however, even if this social media group offers support, the discussion can sometimes be disrespectful. Shaming and blaming remarks can occur on this group, and this could result in some leaving groups that they won't enjoy participating. And during my field, one of the mothers leave a group because she gets some remarks because she refused to. She had question for the vaccination of the baby, and she was very fearing the vaccination, and because she got remarks that were very hard, she left the group. But why mothers need to get informed so much? So one of my findings is the importance for some mothers to be informed before taking any decision and to be comfortable with that decision once made. It is important for mothers to have choice and also to question the norm. The importance to make informed choice was also crucial for mothers as they do not trust scientific knowledge or governmental information. They consider that medical information is only one way, so if they want to be informed, they don't have the choice to go on the internet. In some cases, we may associate this with the importance of empowerment. And that was more on the naturally approach group that we could see that. So they question the norm to make an informed choice, and they go on the internet, and sometimes what they see on the internet, they can bring the mothers to question other norms. So for some of the mothers mentioned to me, for example, that, for example, they have question about sleeping, about other topics, and then when they join group, then they had question, they saw the subject of vaccination, and then they start to question vaccination that they didn't question before. And so, for example, one of the mothers mentioned that regarding the importance of choice. I am pro-choice. I'm really pro-choice. I don't even know if we can say that, but I am for the informed choice. We need to get informed. We need to confirm what is done since years, the tradition. We need to confirm that is the good things to do, or we might have the right for something else. So the practice to get informed. How do they get informed? So internet is used a lot, and it is an initial reflex to get information. Mothers can subscribe to different websites or groups. However, books still is important. In Quebec, we have this book From Tiny Tot to Toddler that is very, very used by mothers. And internet is really easy to use, that some participants mentioned that they were checking for everything. For example, one mother mentioned to me, you see something on TV, you check on the internet. You read something in a book, you check on the internet. You hear someone saying something, you check on the internet. So it is really internet. So the practice to get informed, how do they get informed? So Google is used for general questions to get an idea on one subject. They can use also specific website if they think they could find information on it and if they trust their website. Some others mentioned that they could make a permit research also for specific subject, which means that some of them are comfortable with database and scientific article. But they can also ask questions on their social media group, mostly to get the opinion of specific person that they like. This type of search is mainly used when the model wants to get an alternative approach. When they ask on social media group, they can get advice, opinion, or reference suggestion. For example, here is 2 questions about vaccination that was asked on the natural approach group. Mom, I need you. The vaccination appointment for my 2-month-old daughter is tomorrow. This is my first baby. I wonder if I'm really doing the right thing. I do not know anything about. I'm worried. What is your opinion on this subject? What are the risks to take? Thank you. And then later on during the year, another one asked this one. I know this is a hot topic, but my baby has his 2-month vaccine appointment tomorrow morning, and few hours before, I'm still ambivalent. It stressed me. I hate having to make a decision between 2 possibilities that I consider unsatisfactory. Those who choose to vaccinate, did you have all the vaccine given? How did it go? And the other, what really motivates the choice not to do it? Thank you for sharing your experience with me while respecting that of others. Model use social media to ask questions and to share experience, opinion, and information. Model could share experience with vaccination, like to answer to this type of question. They could share experience with vaccination or vaccine preventable disease, their views on vaccine surveillance, vaccine utility, or vaccine efficacy. Model reply to questions on vaccination also by sharing mostly books in this favor, as well as the movie Shot in the Dark. So here we can see one book, Qui aime bien vaccine peu, which is Who Loves Vaccinate a Little, Care for My Child also, that has a section in this favor of vaccination, and also other books that are not in favor of vaccination. There were also other references that were sharing, like for example, in favor of vaccination. Here we have, for example, the pharmacist, who is a popular blogger, was also cited, but this one led to a controversial debate when he was cited, and also some reference about Public Health Agency of Canada, who are the National Institute, or the ministry website. So the question is how models assess information validity. So to assess information validity, they combine different strategies. They try to check reference and they triangle the information on different websites. The experience of other models, which is called apomediation, is also central to trust and consider that an information is valid. However, all experience won't have the same value. If they know the person or if they trust the person on social media group, they may take into consideration the experience. But if they read an experience from someone they don't know, they will be cautious toward this experience. So it's not because a mother sees something on the internet that she will trust the information. However, most of the time, the model will trust information that comfort her initial opinion and will dismiss contradictory information. And this one is very important, and the model are very aware that they trust information that comfort their initial opinion. Like for example, during the interview, one was mentioning, I will check reference, but I will not automatically assume that they are good. It is more a mixing. If I see the same information everywhere, I will trust if the reference seems good to me. Also for the apomediation, so which means that model refer to other models to trust information, and its apomediation is mostly based on the importance of experience. So one was saying, I will say, if I don't know the model, but the model says something that seems credible, I may take it into consideration, but not as a true story. But if I know the model very well, I will accept her story a lot more. The importance of book. What I will get on the internet on the vaccination topic is the girl's opinion. For sure, sometimes girls were saying, go read this article or this thing. So yes, sometimes it brings me to read stuff on the internet, but my decision, I really make it thanks to the book that I have, because honestly, I have hard time with websites like Health Canada or the CDC. I have difficulty distinguishing what is serious or not. I'm that bad with the internet. And also, so finally, the information that's strange or confirm an opinion. So one of them was mentioning, I will probably read things that will be more in line with my view, you know, to strengthen my opinion and reassure myself that I made a good choice. So the pharmacist, so the person that we see here, it's the pharmacist, so one answered the question by putting the website of the pharmacist, and she got that answer. The pharmacist is far from being a good reference for or against vaccination. Is far from being a good reference, that's it. Is not very appreciated by a vaccine hesitant mother in Quebec. And also the difficulties with the reference, and one tried to mention who that is, and she said, who recommend vaccination? It's a credible source that everybody likes to cite for breastfeeding. So their view on vaccination should be as credible as breastfeeding. So that was one who wanted that was in favor of vaccination, but she get this reply: breastfeeding and vaccination are two distinct departments in WHO. This is why I don't put them on the same level of credibility, to be honest. Too many gray areas and potential conflict of interest during the H1N1 pandemic. So the difficulties to validate information. So even if they develop strategy, most of the models mention that they got too much information. They have difficulties to check reference. Also, for some subjects, some model express doubt regarding scientific knowledge, governmental information, and health professional advice. This results in difficulties in ensuring the validity of information, as well as finding good balanced information. Like, for example, one participant told me this during the interview: me, swallow information from the nurse, I'm not interested in that. I know that I will probably get bullshit from her, and I am a bit too critical to swallow what they will tell me. But if you don't listen to them, then what are your options to get informed? But by offering the possibility of more choice, internet can increase doubt and dismiss most self-esteem. So that was one of the results of my thesis, is that by they want to check everything, and they want to question everything, and they want to make informed decision on everything, not only vaccination, but at the end, you know, they doubt for everything, and sometimes it can be difficult for some of them. And for example, one was saying that the best example is sleeping. On one side, they will tell us sleeping, cry. On the other side, they will say, no, 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 if you don't do that, if you do that, you are a bad mother. Your son will be traumatized for all his life. So you have a lot of information, lot of tips, lot of possibilities, but we don't get an answer. The informational reflexivity. All models mention the need of competency to assess the information validity. And all models with a university degree express the importance of their scholarship capital. I have to mention that out of 19 interviews, 12 had a university degree, and 12 at a university, 4 at a college degree, and only 3 have a secondary or less degree. I could also notice, but we have to be careful because it's only 19 interviews, that there was a difference between health and technology program, that they use their scholarship background to validate information, and the social science humanities background that they use to question the norm and governmental information. But this is something that could be checked further. Like, for example, one was mentioning that she was a little bit joking, but you know, was not completely a joke. She mentioned, I have a university degree that gives me the possibility to question the states. I studied philosophy. So I have also to notice the group difference. So there was a big difference between the group who had the same delivery date, and they did not question a lot the vaccination. Only one mother questioned the vaccination. She had doubt regarding vaccination, but she was more fearful. She didn't know what to do, and she was scared about vaccination. But she just get answer to trust information, to trust vaccination, sorry, and to go and vaccinate. But nobody understand really why she was so scared about vaccination. And one day she shared something about vaccination, something that was anti-vaccination, but she had question about that. And she got very disrespectful comments, and so she left the group. But you know, she was one of the starter of the group, and she probably stayed on this group 8 or 9 months. And she was one of the leader of the group, because the only thing that she questioned was vaccination, and she left the group because of that. But the other group, the natural approach group, were more concerned about vaccination and debate. And during the year, it was 17 posts about vaccination that were asking questions, exchanging information about vaccination. So in order to conclude, I think I went a little bit fast. So what is important is that for some mothers, it's important to make an informed choice, and it's crucial for mothers. And for some of them, they can see that as being a good mother, that now it's part of the intensive mothering. So a good mother cannot just follow what we told her to do. She has to ask questions, and she has to understand and to know why she is doing things. The importance of making informed decision brings vaccine-hesitant mothers on the internet, and they join group that they share their vision on mothering. Which means that sometimes they can join group without being ambivalent or hesitant regarding vaccination, but they can become hesitant toward vaccination because, you know, because she joined this group. But it's not because a mother is on a social media group on the internet that she will necessarily get bad information about vaccination. It really depends on the group. And I will say most of the group are still, they share information that are in favor of vaccination. Vaccine-hesitant mothers check information that comfort their choice, their opinion, or their value, and this is very important. And this is the reason why they might say, I won't go to see a governmental website, because I know already what is going to be on that website. So they really want balanced information, which is difficult for them to get. They also mentioned that they have difficulties in ensuring the validity of information. And so they express doubt for scientific, governmental information and health professional advice. But they are not comfortable also with anti-vaccination propaganda. So they don't like also anti-vaccination group or anti-vaccination website. So they are really ambivalent, and they want to get information that which is that present vaccination a little bit à la carte, as we say. They like that it's they appreciate, for example, Dr. Seuss, because, you know, you can manage your schedule and something like that. For vaccine-hesitant mothers, the internet offers the possibility of choice, but also could increase doubt. So I want to thank you, the participant of my research. I want also to thank you, Raymond Massé, that was my thesis director, and F. Dubé, she was my co-director, and also the Fonds de Recherche Société et Culture and the Canadian Immunization Research Network and the Social Science and Humanities Research Council of Canada for their funding. So there we go. So if you have any question, please, you can ask them to me. You can say here.
Okay.
Sir.
Yeah. Thank you very much, Maryline, for your presentation. That was very insightful, especially in the age of the internet, Web 2.0, as we call it, where there's so many proliferation in social networks. At this point, if anyone has any questions, please go ahead and open up the Q&A feature at the bottom of your screen. You can go ahead and type them away. And also for those who joined us a little bit later, please note that this webinar is being recorded and it will be shared with you after in an email, and it also will be available on our website as well as the CPHA's YouTube channel. A question that also came up was that the slides for this presentation will also be available afterwards. So we have the first question, and it's, how can healthcare professionals promote reliable sources of information online?
Okay, as now it's difficult because when I'm telling you that vaccine hesitant mothers don't trust governmental information, and it's true that as a health professional, but usually we direct the mothers to governmental information or scientific information. I think it's the way that we present the information. If we tell them, listen, there is a website, for example, Immunize Canada, that is a very good website. If we tell them, listen, this is in favor of vaccination, I think it's important. I know that that you have question about vaccination and that you don't trust the government, but I think it's you could go on that website. I think it's the way that we present the website that will help, and to say, I understand your point. And as soon as you say to the mother, I understand your point, I know that you need to take time you need to think about that. So so I think we can still send the mothers through website, but good, that website that we know, because it's true that sometimes it's difficult to find the information, or the article or the website can be very hard to navigate or stuff like this. So maybe it's to find one or two very good websites, and to tell the mothers to go and visit the website by telling them, you know, it's governmental, it's in favor of vaccination, so it will advise you to vaccinate, but I think the information you need to take it into consideration. And also don't hesitate to, if you have sometimes scientific, but not too heavy, or scientific scientific article, some of them, like, you have to ask them what is their background, because some of them is able to read that stuff, and to ask them what they know already about vaccination. So maybe it's something it can be done.
Okay, thank you. So just to so for any healthcare professional who are promoting reliable sources, the way that we present that information is really important. And so we have another question here. So Maryline, it's on your opinion, do you have any doubt that vaccine hesitancy is directly related to the internet?
I don't think internet is the only responsible for vaccine hesitancy. You know, since the years 70s, 80s, we tell to the citizen to be empowered, to take care of their own health. So we advise them. We say that they should be informed and stuff like this. So now that they want to get informed, it's true that sometimes they can start to have questions. But internet is I don't know, in French is the catalyseur, I don't know in English, you know, it's
catalyst. The
catalyst, yeah. And you know, the internet came and maybe accelerate the movement because of all the information, and now everyone everywhere can get this information. But I don't think that the internet is the only responsible for vaccine hesitancy. I think it's much more larger than that, and it's maybe a tendency in of the citizen to now question. You know, people are now more educated, and so they can start to have questions. And it's true that to answer those questions that they may have, now they have internet. Before they didn't have that. So I don't think it's only related to the internet.
Okay. And just along the lines of presenting information and referring mothers to reliable information sites, one of our attendees wants to know, is it possible to provide a list of reputable information sites that you will recommend?
Oh, I didn't check all the website. I navigate through, I think it was Immunize Canada and Immunize BC also. I think Immunize BC was one good website because he was putting his reference, and sometimes he was giving he was giving also a scientific article or mentioning the scientific article. So I think Immunize Canada, Immunize BC, but to be honest, I didn't check all websites.
Yeah, and I think that's something that CANVax will also help provide as well, a reputable list of information sites. I'm sure that on the Public Health Agency website, they have a list of reputable information sites. Same with the Canadian Pediatric Society, they have a list of reputable vaccination information sites. So for our attendees, you can go ahead and check out those sources as well. And another question that just came up, has the topic of vaccine hesitancy ever been researched with dads?
In my knowledge, no, not yet. And I think it should be done. When I start my thesis, first I wanted to ask parents. The fight is when I decide to join maternity group. So obviously I select the mothers. For my thesis, that was one of the remarks of the jury. Where are the dads, and do the dads have something to do with that? And I think they play a role also. But it's true that mothers still the one who take care of the health of the children at home. The fight is sometimes also dads can have an opinion. They have an opinion on vaccination, and their decision or their opinion can also play a role for the vaccination status of the children. And that should be done. It's the question, and I think it will start because now dads are taking more place for the health of their children. So of course, it's a study that should be done.
Okay, yeah, that's definitely a good question. What about the other side of the parents? So if there's any attendee that are currently typing questions, we'll give you a couple minutes, about 1 to 2 minutes, to go ahead and ask a couple of them. Otherwise, I know it's a little bit short, but the presentation we'll probably conclude around 1:45, 1:50, depending on how many more questions we get. And I see that we have another question for Maryline here. Do you have any suggestion on how government websites can improve their content or the way that they present content?
Well, I think first they should so of course the website should be appealing, and it will be easy to navigate. The parents don't have to go too much to search information. With F. Dubé, we wrote an article that we were making a comparison between the website of Quebec and the website in France. And that was published in the public health, I think, review. So I think we in the discussion we present some tips to go to improve the content, because most of the website, they present data like the calendar and stuff like this, and also they answer they have the frequently asked question, like for example the link between ROR and autism. The fact is, you know, most of them, they just mention, oh, there is no link between, but they should mention how many studies can mention that, how these studies work. Like the mothers, they want, you know, you cannot just tell them studies have shown that there is no link between RRO and autism. They want to know how many studies, how did they conduct the studies, what was the financial of these studies, and so they're able to understand it. But the fact is, we just bring them the result. So maybe a little bit of more information for the one who wants to want to get this information. And this could be written, but this could be also now with all the tools that we have. We can do, I don't know, like a little capsule, video capsule to say, to present, for example, okay, there is 15 studies that try to that studies the link between RRO, and they didn't find any link, and this is the way that they did the study, and this is why we say, and maybe that will be a way to improve to improve the content. Just not bring the fact, but to say what are the studies behind the fact.
Okay, yeah. Okay, and just to clarify on that, the RO is French for measles, mumps, rubella. Another question that's up is, what is the best way to approach vaccine hesitancy with parents that have been unwilling to discuss and refuses the vaccine at the regular well baby follow-ups?
Well, okay, I will base, because, you know, I am an anthropologist, okay, I'm not a doctor, and I'm not also specialized in communication, but I did a lot of interview because I work a lot with FDB. So I talk with a lot of vaccine hesitant mother, and they don't want to tell them what they have to do. And maybe one way to talk to them is to say, well, I know that you have concern about vaccination, and it's normal to have concern about vaccination because it's an important decision. But you can also tell them, you have to understand that I am a doctor, I'm a nurse, and I am in favor of vaccination, and that I will advise you. You know, you have to understand their point, but she has also to understand your point. And so is to bring that. Just to say that you understand that sometimes it can be frustrating because of the pressure of the norm, to understand that it's not sometimes easy for her, and to give her time. And maybe it's anecdotal, but one of the mothers say, well, the nurse she asked me, do you want to vaccine too? Because, you know, she had a lot of discussion, and the nurse says, okay, are you comfortable to do the vaccine today? Or if you want, I can give you more time, and you can go back home. And I know that it's not regular, and it's not good, and we need to follow the calendar. But she said, I was so surprised. So she took 1 week to think about that, and then she came back. And maybe, you know, I know 1 week it could be important, but sometimes 1 week, then if she follows the calendar, it's better than nothing, than a mother that decides to don't go to the follow-up of their baby, because she knows that she will be asked for vaccination, and that she will have to fight to say no to vaccination. So maybe it's to find a compromise, and to don't put pressure, and to say, I understand you, I know you have a lot of pressure for that, I'm here to listen to you, I want you to be comfortable with your decision. And, you know, that will change the relation, and she will say, I am respected as a mother, and the choice relies on me. And this is mostly what a vaccine hesitant mother wants.
Okay, all right. And a follow-up, for those mothers who are vaccine hesitant in your study, did they decide to immunize their children according to the recommended immunization schedules?
Most of them, the one on the website on the ethnograph, I don't know because I didn't. But for the one I interview, I will have to have a look at my results. But I will say that some of them choose to delay vaccine. Most of them, and I think only 2 refuse all vaccine. But at the time she said, I'm thinking about it. And one of them wanted to wait until the child was 1 year old. But I finished my interviews before. But most of the hesitant mother, they delay vaccine. Maybe they delay, like the calendar start at 2 months, and they start it at 4 or at 6 months.
Okay, so in that case, did any of the mothers accept the vaccines according to the schedule in your study, in the interviews?
Yes, well, they accept, but some of them delay the vaccine. Only 2 refuse all vaccine. Okay. But, you know, as I say, maybe they start the vaccine at 1 year old. Okay.
And so another question we're being asked is, what is being done to combat vaccine hesitancy with new parents?
We tried to, like in Quebec, there was a project of interview, motivating interview. Entrevue motivationnelle. It's at the maternity before the mother leave the maternity. It's someone that come to see the mother to speak to her about vaccination. So I don't have the result of this project yet, but this is what has been done, and also we try to talk to the health professional. To tell them how to answer and to deal with vaccine hesitant parents, which is not easy because most of the times, you know, they don't have too much time.
Okay. Yeah, and for anyone attendees, so the motivational interviewing in Quebec will be one of our upcoming webinars in February. So that registration should be coming up shortly at the end of January. There is one comment here that it is, and I will share the link with everyone here. It is interesting to see that intensive mothering concepts are used in a new publicity for pharmacy in Quebec. And so everyone should be seeing that link now. It is a YouTube link, so thank you very much for sharing that. If anyone does still have any remaining question, or that you are in the process of typing, I believe we're pretty good on time. If you would like, I can give you 1 or 2 minutes to finish typing those up, and then we'll answer the last questions and have a wrap up.
Maybe I just want to precise that the concept of intensive mothering was brought by an author called Eyes, and it was in 1986 that she wrote a book about intensive mothering. So intensive mothering is not a new concept. It's something that is maybe 20 years.
Okay, so we have a comment here for if we can share the article about recommendations for website content. I think the question here is about the article you mentioned, Maryline, the comparison between the Quebec and France publication.
Maybe I can send it to you, and then I don't know, maybe you can share it with...
Yes, we can definitely do that. Okay. We can share with all of our attendees for that. Okay. Any last burning questions? Okay. All right. So that brings us to the end of our webinar. So thank you very much, everyone, for joining us. Please don't forget to provide your feedback using the survey that will be made available to you upon the closing of the webinar window. We do have an upcoming webinar coming up with Dr. Karina Top as well on the adverse events in immunization. So look out for that. So thank you, everyone. Thank you very much, Maryline, for your wonderful presentation and for answering your questions about intensive mothering and vaccine hesitancy. And I hope everyone have a wonderful afternoon.
So thank you very much.
Okay. All right, thank you.